The value of a residency program is hard to define and measure. The preparation of newly licensed people to fulfill their demanding role that is present in healthcare today is amazing.
The nurse residency is something that is essential to taking a new graduate from having all this didactic knowledge and some clinical skills, but taking all of that and moving it into our residency program gives them the opportunity to gain a lot of insight and that magical term of critical thinking.
We started to explore structured programs, residency, and the HealthStream residency program just gave us that structure that we were looking for and needed to provide the platform to support our newly licensed nurses.
When we started using HealthStream, the thing that exceeded our expectations was the fact that we had evidence-based courseware, we had the confidence assessments that we were not implementing anything like that. We had knowledge assessments. We had the dashboard or the control center so that we could watch our residents' progression throughout the program and ensure that we were giving them what they needed.
The first cohort of the pilot facility, when they started the residency program, they had as high as a 26% turnover rate. And after implementing the residency, they have seen it go as low as 12%, and it continues to decrease.
It was very important to find an organization with a great residency program because I did not want to be thrown out to the wolves. I've heard several hospitals do not have residency programs, but their nurses are more likely to quit because they don't feel prepared enough to take care of the patients by themselves. And with the St. Michael's residency program, I felt very prepared.
I went through the nurse residency program 3 years ago as a new grad. I think that the biggest advantage to being in the nursing residency program is just having a community of others who are going into this at the same time. It's really comforting to know that there are other people going through the same things who are having the same struggles as you. And it's nice to have a community when you're going through that first year.
I think since we gained the PTAP recognition, we've really attracted the cream of the crop nurses. Nurses know that we have high standards. And it's also a big deal for these new graduates to say that they're working for a hospital that offers an ANCC accredited nurse residency program.
The confidence level that we have from our residents is palpable. You can tell the difference.
Over the year, my skills have grown and my confidence has grown. When I first started, I was not very confident in anything that I did. I had the knowledge to do the thing, I just did not want to do it because I was afraid of making a mistake.
That confidence doesn't come without preparation, doesn't come without support, doesn't come without planning. And I think as we transition our nurses through that first 12 months, that it has made an impact on their ability to deliver our mission, to live our mission.
Having a nurse residency program where we dedicate time for a group of new nurses to spend talking about things, looking at things, developing simulations that try to put things together, that is golden moments. It's just golden.
I think the most impactful aspect of the nurse residency program would have to be the preceptors because they can either make or break you. You have a great preceptor, you're going to have a great time, they're easy to learn from, and you just have that connection, you have that bond that you're able to go to at any time. I still talk to my preceptors and it's been a year.
Through our experiences at St. Michael and through the experiences at St. Elizabeth, we feel very confident about the ANCC transition to practice residency program and the delivery through HealthStream.